just dry skin, rashes all throughout his body. Then he came to me saying, hey, have you heard about this product, Day 90? His skin finally got to that full resolution that we were looking for.
All right, Dr. Dang, thanks for jumping on the call with me. I really appreciate your time. Can you give us a little bit of a background on what you do for a living and why you're a naturopathic doctor, or what your education is?
Well, thank you for having me, Eric. I'm so excited to be here. My name is Dr. Dang. I am a naturopathic doctor. And so for those who haven't heard of what naturopathic doctors are, is we are conventionally trained, but holistically have a holistic mindset. And so that being said, I focus on getting to the root cause of a variety of different health concerns and specifically focus on gut health, focusing on the gut microbiome, hormone health, skin and hair health too. So other things naturopathic doctors do is they do a lot more in-depth lab testing, more functional lab testing to really try to understand what's going on with the body as a whole. And so rather than treating different parts, they look at it systemically. So I think naturopathic doctors are great if individuals are wanting to just get more answers with their health, to take deeper dives when it comes to their health too, and also focus more on diet, lifestyle supplementation with some medication sometimes sprinkled in there if needed.
Wow, that's incredible. And how is that different from a dermatologist? Do you have the same level of education, or is it kind of a different approach?
We get this question a lot. So we go through a 4-year accredited medical program, and then we have an optional residency that we can go through afterwards too. Because we're so holistically trained, that's why a lot of people don't specialize. But with dermatologists and other specialists in the conventional field, they go through, at least 3+ years of residency to really specialize and work in hospitals. And as naturopathic doctors, myself included, I went through a primary care residency where I got to see multiple different specialties and conditions and work with a bunch of different doctors. And that way I just got a higher volume of patients, and some individuals can go into certain specialties. So there are some naturopathic residencies that do oncology, that just do digestive health, that just do hormone health and HRT, that just do cardiovascular and metabolic health too. So there are options out there, but there's probably about 10% of individuals that actually match for residencies. So it's highly selective.
Now, is that the same as integrative medicine? Is that the same definition?
Yeah, so there's a lot of buzzwords out there. There's integrative medicine, there's functional medicine. So naturopathic doctors are very integratively trained, but then you can also find certain MDs who have additional integrative medicine training. I know there's some fellowships out there, especially I think through the Weil Institute in Arizona, if I'm not mistaken. They have a specific fellowship for a lot of MDs and DOs. And then now there's functional medicine. So there's actual functional medicine certification that MDs, NDs, and DOs can additionally get to get much more of that integrative training.
That's incredible. And so did you get a lot of training on the gut-skin connection when you were going to school, or did that kind of happen when you got into practice?
So that's where my first love was when I started medical school. I knew from the get-go I wanted to focus on the gut-skin connection as someone who personally has always struggled with, those concerns, and I had just seen it clinically so much too. So I remember starting my first year of medical school, and there was the derm professor. She was just, I think, guest speaking one of our classes. I went up to her right away and was like, hey, I want to learn everything I can about derm. So she basically gave me all the resources that I needed. So outside of, going through medical school, I was, interviewing certain doctors, preceptoring with them, learning as much as I could too about the gut skin axis. So I'd say we're definitely trained in it, but I really took a deep dive into it.
Yeah, the gut-skin connection doesn't really seem to be addressed like in the dermatology office or in the regular doctor's office, but it's been described really since like the 1930s. So why do you think that this gut-skin connection really hasn't been addressed until recently?
I think that oftentimes people treat the body separately, like I mentioned. So the gastroenterologists treat the gut microbiome, the dermatologists treat the skin microbiome. And there isn't much conversation between the two. And so now I think there's more and more emerging evidence coming out there of the actual cross connection between the gut microbiome and the skin microbiome too, and how they communicate with one another. And so I'd say more and more conventionally, people are starting to get more awareness now about that there exists this communication pathway. And what I think is interesting too, in the past, people were given antibiotics left and right for any type of infection. And now at least there's more awareness of like, oh, let's make sure you're taking a probiotic when you're on an antibiotic too, because antibiotics are just bombs to your gut microbiome. They wipe out everything. So I think people are starting to gain just more awareness. And I think there's just a lot more research out there nowadays too.
So someone that's never heard of the gut microbiome before, like what is it? How would you describe it to somebody who's maybe not real versed in, microbiology? What is the gut microbiome?
The gut microbiome is a terrain of bacteria. So we have good bacteria, we have not so good bacteria, call it more harmful bacteria. We have bacteria that are called commensal, they just take up space there too. I like to bring it down to layman's terms. I tell people that our gut bacteria is like little soldiers in our gut. And we want more soldiers, we want more of an abundance of good, healthy bacteria in the gut. Because let's say we get foreign invaders that come in. Foreign invaders can look like bad bacteria, it can look like parasites, it can look like candida, all of the things that gut microbiome is exposed to. And let's say we don't have enough little soldiers protecting the gut. What happens is these foreign pathogens can come in and invade the gut, and they can, claim the gut microbiome to be their new terrain too. So the gut microbiome is just this diverse ecosystem where all of the bacteria are communicating. There's also the gut lining. It's a mucosal lining too. We have a muscular lining to protect it around it as well. So it's this beautiful interplay of something also called gap junctions. And so I know the word leaky gut, it gets thrown around a lot there too. But what happens is when we have enough good bacteria, we have a strong, healthy gut barrier, there's a less prevalence of the leaky gut. But what happens is, let's say more and more of these foreign invaders come in, they actually create a lot of inflammation and then actually breaks down the lining of the gut, which then contributes to this condition called leaky gut.
Wow. And so how does the gut microbiome then influence the skin? How does it go from that to into the bloodstream and to the skin?
This is a great question too. So what happens is, let's say there's inflammation in the gut, and that's breaking down that gut lining, which is then contributing to the leaky gut. And so what happens is it creates this inflammatory immune response. So now the immune system gets overactivated. And what happens then is it signals to the skin that there's this inflammatory, condition that's happening too, which then often presents onto the skin. And so this can also come from, we have something called short chain fatty acids. We have certain gut bacteria that can also present on the skin too. And so because of this communication pathway of the gut and the skin, I like to say that the skin is a huge reflection of what's happening in the gut. The skin exactly mirrors the gut too. So if something's coming up on the skin too, it means that the immune system's activated, creating this inflammatory pathway.
And how common is this in the clinic, where you see this situation of maybe an imbalanced gut microbiome affecting the skin? And how do you test for that? How do you know that that's influencing the skin when, let's say, a patient comes in?
I see this all day, every day. And so what I think is fascinating is 90% of individuals, when I ask them, do you have digestive issues, either say yes, or if they say no, I prompt a little further. Okay, do you have any, abdominal distension, otherwise known as bloating, any trouble going to the bathroom? Have you recently had food poisoning? Have you traveled and gotten sick? And almost always the answers have been yes. And if there's been a yes to any of those questions, I always test the gut microbiome. And so it's pretty rare for someone to walk through my door and say, hey, I have absolutely no digestive issues. I have never gotten sick while traveling. I've never taken antibiotics. You're in the 1%, maybe even less than that, if that's the case. So most of us have been exposed to a lot of different pathogens here too. And the way that it can manifest is it can manifest as digestive issues. It can manifest as skin-related concerns. So I see acne all the time. I see dry skin. I see, different lesions around the body. I see rashes. It can come up in a variety of different ways. And so what I like to do is I like to always test the gut microbiome. And with doing so, we get a really good idea of what's happening, not only with the good and bad bacteria, if there's any of those foreign, pathogens in there too, but also is there inflammation in the gut? Is there potential leaky gut? You can actually evaluate that through something called zonulin. We can look at digestive acid. So how well is the gallbladder, breaking down fat? How well is the pancreas providing proteolytic enzymes to help to support the breakdown of proteins and carbohydrates? We can look at if there's any backup of hormones, specifically beta-glucuronidase in the stool. And then we can now, through metagenomic testing, find very specific strains of bacteria. And so there's just really so many more advancements with gut microbiome testing nowadays.
Wow, that's incredible. So could you comment on what the typical gut microbiome test result looks like for a person struggling with skin problems?
Yes, absolutely. So sometimes I use PCR technology, and in doing so, I usually see more of an overgrowth of usually two things. There's either Staphylococcus is a big correlation, Staph aureus, with those who have more skin concerns, Streptococcus as well with those with skin concerns, and then I often see a pretty significant elevation of Candida, which is a type of yeast. And so with most of my skin related patients, definitely targeting those is very important. So for those with Staph aureus or Streptococcus, we usually like to go through an herbal protocol to try to reduce the presence and the prevalence of them. But what I like to tell people is if you've ever had strep throat or shared anything with anyone who's ever had strep throat, strep is a very common species, but sometimes it doesn't fully get out of the body too. Same thing with staph. Staph is a very common skin condition or skin microbiome, skin bacteria. And what happens is we can just have, too much of it at times too. And that can create a lot of different, rashes and itchiness on the body. And then with Candida, that requires a very specific protocol. Candida can usually come on after a round of antibiotics. People tend to notice that they have more sugar cravings too. That's a potential sign that there might be some Candida in there too. Candida is a little bit harder to eradicate fully, but it is very possible.
Wow. That's incredible. So what does a best case scenario look like? How do you go about advising people that come in with this gut skin connection issue? What do you tell them from a dietary perspective, how to balance the gut microbiome, how to protect the gut wall, how to improve their skin health? Where do you start? And then what does success look like at the end of that?
You know what, Eric? I love this question so much. So, what I do first, actually, for any type of patient that comes in with any type of skin condition, I actually put them on Skinesa probiotic. And the reason that I do that right away before I even test is because I've read the research and I've read the clinical trial saying that it does take about 90 days to start to see changes with their skin. And so for someone that specializes in the gut skin connection, what I love to do is start them on the probiotic and I let them know immediately, hey, it's not going to be an overnight change with your skin. Give it 90 days. But in the 90 days, we're already making progress in terms of your skin health. And I want to investigate further. So that's when we sit down and we look at potential food sensitivities if they're interested in that, or if I think that there's a strong correlation there. We then also look at the gut microbiome. And depending on what comes back, I always like to first get rid of what's causing the inflammation that's activating the immune system. And then we really heal the gut. So when it comes to, I call it a kill protocol. When it comes to a kill protocol, I have them either avoid certain foods that are inflammatory for them, or have them go through a candida cleanse, or have them eradicate the certain bacteria. And it's usually about a 4 to 6 week protocol. And then it's a strict 3-month gut healing protocol. And in this gut healing protocol, we really focus on adding in more pre and probiotic rich foods. So I always say try to get at least one probiotic rich food into the diet every single day, whether it's yogurt, whether it's kombucha, kefir, miso soup, sauerkraut, kimchi, whatever it is, one thing every day, but then also you want to feed the prebiotics, rich bacteria in the gut too. And then it also looks like having a lot of fiber-rich foods. In today's day and age, when everyone's really focused on protein, people are forgetting about fiber. So I like to tell people, eat your fruits. A lot of people are forgetting a lot of their amazing fruit out there. And then having things such as brown rice and chia seeds is one of my favorite fiber-rich foods. And then really focusing on gut healing and the gut lining. And so that can look like bone broth. That can look like certain nutrients such as L-glutamine, N-acetyl-D-glucosamine. It can look like zinc carnosine. And my personal favorite is actually colostrum. Colostrum has been shown to be very helpful with supporting, inflammatory conditions in the gut, and then also helping to reduce that immune activation.
Wow, fantastic. In regards to Skinesa, why do you recommend that specifically versus, some other general probiotic that you could see on Amazon?
That's a great question too. So, well, first, what I love about Skinesa is that there is research and evidence around it. And so I can say not a lot of probiotics out there have that. And so, first of all, I love that it's also skin specific. But then secondly is that there are certain strains, and it comes from, you have the genus, the species, and the strains that's already targeted in the Skinesa probiotic. And they've been clinically shown to help with a variety of different skin concerns, such as rashes, such as dry skin, such as lesions on the body too. And so I have a lot of confidence because of the research around Skinesa to recommend it to my patients.
That's great. Can you give us a specific example of what success looks like with Skinesa in the clinic?
Absolutely. So the first thing that comes to my mind is I was working with an individual who had been going through topical steroid withdrawal for probably about a year and a half before she walked through my door. And it had impacted her so much that she couldn't leave her house. And so she reluctantly came in for the first visit just so I can see, her skin and what was going on. And she was just at her breaking point. She had tried to see so many different dermatologists, acupuncturists, Chinese medicine practitioners, whoever she could see, estheticians, she tried to see them, and nothing was helping. And her skin was oozing all over. And she had to keep her skin fully covered in emollient cloths to keep it hydrated. But I felt so bad for her because she couldn't even leave her house to go to the grocery store. And she was young, vibrant in her 20s. And I just realized, that's just not a way to live life. Anyways, we did testing immediately. At this point, I hadn't started her on Skinesa just right away. We decided to go through testing first. We found out she had quite a few different food allergies and sensitivities. She had the candida overgrowth as well in her gut. And so we started to put her on a protocol. The first thing that we did was take her out of her allergic environment. We found out she was allergic to cats, and she had, I think, 3 cats in the house. So that was something that we, had her change in her lifestyle. And then after we went through eradicating the candida, we put her on Skinesa, and like clockwork at day 90, I kid you not, her skin completely had healed. And what was amazing was we were doing all of the right things of getting to the root cause, and we were getting progress. We were getting 20% better, then 40% better, then 50 and 60, but we never could get to that 100% improvement. And it really was 90 days after putting her on Skinesa that she was a brand new person. She got her life back. She was traveling again. She got married. And I think that was the biggest transformation that I'd seen, was someone who was so afraid to leave the house to being fully vibrant and living her life again. So that was a really big win.
Wow, that's incredible. Can you explain what topical steroid withdrawal is to the general public? Because there actually is really some controversy on whether or not it's a real condition, believe it or not. And if you go to certain forums, like on Reddit, there's a real discussion where some people say that you don't need to be worried about it. It's blown out of proportion. It doesn't even really exist. How prevalent is topical steroid withdrawal? Do you see it in the clinic? Do you have any information on, how prevalent it is?
That's a great question. I would say I don't have information on the prevalence, but I've definitely seen topical steroid withdrawal in the clinic several times. And it is really, really impactful. And the mechanism of what happens is the topical steroid is actually suppressing the inflammation. So, with those who tend to have certain skin conditions, if they're having rashes that are pretty inflammatory, so it goes and basically reduces the inflammation, almost blunting it, especially if you've been on steroids for quite some time. But the thing about steroids is they thin your skin. So after a certain time period, you do have to slowly taper yourself off, or you have to discontinue the use of steroids. You can't use topical steroids indefinitely. So what happens, especially if the root cause hasn't been addressed of why certain skin conditions are occurring, the inflammation is going to come right back. So you pretty much are suppressing the inflammation. You're pretty much turning the gas stove off, and then using the actual topical steroids. But then after a certain point, you have to reduce the use of it. So the inflammation comes right back. And in doing so, it can come back with a vengeance. And so people's skin actually tends to get more inflamed. It can get blistery, it can ooze, it can crust. Their kind of whole body gets really inflamed too. And sometimes for those who've been on topical steroids for quite some time or have been on oral steroids to help with their skin-related concerns, it actually impacts something called the HPA axis, which is our adrenal glands. And so our adrenal glands tend to go into overdrive when we discontinue any type of steroid use. And in doing so, it can also create things such as palpitations. It can create insomnia. It can create anxiety. It can create this wired buzzing feeling that's happening all day, every day. I have an example with a patient who felt like she was so jumpy all the time and she couldn't sleep and she was having palpitations and she couldn't figure out why. And we looked at her cortisol and her cortisol was through the roof. We did a 4-point cortisol test and it was just high all day. And I believe that was, from the topical steroid use and the withdrawal of it. And so I know that there's a lot of individuals with different schools of thought saying that it doesn't exist, but I've definitely seen it exist often. I'd say it probably comes through my door about 10% of the time. It's not something that comes in every day, but I think a lot of people are recognizing more and more that naturopathic medicine can't help with it.
When do you get into the danger zone with topical steroid withdrawal? Is it like after months and months of abuse? Or a year of abuse, or can it happen sooner? Has your experience been in the clinic?
I've seen it. It's a great question. I've seen it happen mildly as little as I'd say 4 to 6 months of consistent use, but most people with topical steroid withdrawal have been on steroids off and on for years. And that's when it really shows up. It's the individuals that had, certain skin conditions from childhood, and then they were intermittent throughout adolescence, and then in adulthood, something happened, and they had to go on steroids for maybe 6 months to a year to even 2 years. And so I've seen that happen in any type of variation, but it can happen even through a shorter course of steroid use.
Can you give us another example of the successful use of Skinesa in your clinic where you've seen great results?
Yes. So I'll actually give the story of how I found out about the use of Skinesa. So I probably used Skinesa in clinical practice for about 5 years now. And it was one of my first patients that had, just dry skin, rashes all throughout his body. And we were able to keep it at bay by about 60 to 70%, but we couldn't get to the full resolution. And so this individual actually, I remember he was very well informed of, the research of products. He had tried a lot of different things. He also was a jiu-jitsu fighter, and so he had awareness of how his skin was getting exposed to a lot of different bacteria consistently. And in my mind, we'd really gotten to the root cause. We figured I had really worked on, cleaning up his diet, giving him correct products. But then he came to me saying, "Hey, have you heard about this product called Skinesa?" And at that point I said, "No, but let me look into it." And I read the literature and I was like, this is really promising. And he's like, "Oh, what do you think about me giving it a try?" I was like, "I think it's a great idea." And once again, like clockwork, day 90, his skin finally got to that full resolution that we were looking for, that we couldn't quite get. Even we'd give him certain probiotics to get him there, even though we had given him, certain, like I mentioned, topicals. But this was the first time that I'd heard about it. And this was a great case of someone who was very well informed and who had tried a lot of products on the market.
Wow, that's incredible. So it really kind of shows that you really need an evidence-based skin probiotic versus a general probiotic to really get the great results that you desire.
Exactly. And what I had done with him too is we looked at his gut microbiome. We tried to really repopulate with certain bacteria that weren't as prevalent. And I tried to repopulate with more skin related probiotic strains in there too. But we weren't just getting to the point where we wanted. And that's when Skinesa came in.
Do you have another example of a patient that you helped their skin problems with Skinesa?
Yes, I do. So this was actually a teenager, and she had come in because she was at the not fully at topical steroid withdrawal yet, but she had intermittently used some topical steroids. She realized and read, and even her family was involved in her care, saying, we don't really want you to be on it. But her skin was so, inflamed and irritated and itchy, and she was really, really miserable. And it got to the point where she had been suffering for months now, and then she was having a hard time sleeping. She was not able to do her job anymore because she was someone that had to work with individuals often. And so she started to just really take her health seriously too. And this is where we found out she had certain food sensitivities, and we started her on the Skinesa right away while we were still evaluating what was going on. So she had certain food sensitivities. She had certain environmental allergies. We, added some air purifiers in the house. We cleaned up her gut. We cleaned up her diet. And I think, by doing so, same thing, we got to that 50-60% improvement. But with her, it was day 90 that she was taking the Skinesa, that her skin, she was no longer inflamed. She sent me photos before and after starting Skinesa. She had that, elephant type of skin for those who've been on some topical steroids and who've also she used to get really, swollen at times. So her lymphatic system was definitely backed up too. And so we'd focus on, helping to drain the lymphatics and helping with the kind of the fluid retention. And by the end, her skin went completely back to normal. And she was so happy because she was like, even if my skin is a little bit, elephant-like, as long as it's not itchy and inflamed, I'll take it. But her skin fully healed back to normal.